Thank you for joining the webinar today. There are about 20 million Americans that have thyroid disease, and 60% of them are not even aware of the problem. So I hear this all the time on the internet, and there are so many misconceptions out there. So I get a lot of questions about the thyroid problem. So I have a special interest. I will explain it to you later why. That's why I chose the topic thyroid and debunk the myths, and let's talk about some truths on the thyroid. So this is Dr. Sailaja Reddy. I'm an integrative and functional medicine physician. I'm a certified internist. I have 25 years of clinical experience. And today we will talk about the thyroid. The reason I have a special interest on the thyroid is because I went through many problems. I saw it firsthand. I had like 3 miscarriages after I had my first baby. So I didn't know what was going on. This was about 20 years back. So then at that time, I realized, I was doing some research and I looked at the papers and I thought there was something wrong with the thyroid test and my doctor was not able to figure it out. So I went to the doctor and I explained all my symptoms and what was going on in my life. And I had to request for treatment at that time. So I did not know what was going on, but I was able to conceive after I got the treatment. So then I knew something was wrong with me. So I must admit that my lifestyle was pretty poor. I was so stressed out at the time, and I was eating all the bad foods you could imagine. And it was a very busy lifestyle, doing the residency and everything. Then that's what actually created some interest, and I went through the integrative and functional medicine, and I treated my autoimmune conditions just with natural treatments. So I was able to get out of the thyroid problem and everything happened naturally. So that's how I developed my interest in functional medicine. I chose this path basically, like I feel like I have a calling to provide the highest quality healthcare to the people. And also, my goal is to help patients to tap into the innate healing power to their full potential. I chose this path to contribute and make a difference in the world. So I'm going to share my presentation on the thyroid problems. So all information given is for educational purpose only, do not constitute a medical advice. Then this is my contact information. This is the difference between the functional and Western medicine. This is not a pill for a real medicine. We custom tailor treatment plans, looking at the root causes and do the advanced testing to come up with a plan. And this is a thyroid. So is your thyroid really normal? I hear a lot of misconceptions about thyroid, and I see so much on the internet. I had 3 miscarriages, so no one could figure it out. And I dig deeper, and I found out that my thyroid wasn't doing well, even though the labs were apparently everything was normal. So because of that, I developed special interest on the thyroid, and I had to request my physician, looking at my symptoms and my clinical situation, to start me on the supplements. And then I learned like why I started this problem, because my lifestyle was very poor at that time. I used to eat pretty bad and was so busy doing my residency and having children. And so I needed some help. Eventually, after like few years, then when I learned about the natural ways of treating your autoimmune conditions, I treated this issue naturally. So that's why I have a special interest here to share my life experience. And as a physician, I learned about thyroid medicine, and the functional medicine training helped me more. To put it all together, I'm going to teach you in a simple way. There's no medical jargon here. This is just a simple way I put this presentation for you to understand. So don't think that this is a doctor's language, okay? This is for anyone to understand. So today we are going to talk about the physiology of the thyroid gland, and we're going to talk about how we interpret the labs. And I'm going to debunk some myths on the thyroid gland, the common questions I get from all the patients. Then we're going to see how to keep your thyroid healthy naturally. So I'm going to explain you first about the hormones, thyroid hormones, how these hormones are controlled. Thyroid is basically a butterfly-shaped gland sitting on the base of your throat. One of the chief functions of the thyroid gland is to produce the hormone thyroxine, and which is later converted in your body to an active hormone, which is called T3. And when the thyroid gland produces insufficient hormones, your metabolism slows down, and this can upset the normal chemical balance of your entire body, from skin problems to irregular heartbeat. It is not just one issue. That almost like entire body gets affected when you have a thyroid problem. So when your doctors suspect thyroid problems, they order the thyroid tests, such as TSH, T4, T3. Generally, the screening test is only TH. No other tests are done for screening. So that's not actually sufficient. That's what I'm going to teach you, like what you need to look for and what you need to ask your doctor when you go for physicals. Especially when you have symptoms. The functional medicine approach is very different. So then the traditional approach, I'll show you the differences and what it is. And hypothalamus, and it's a small portion of the brain that controls many bodily functions. So that basically tells it is like a boss up there in your brain. It tells the entire body like what hormones to produce and how to control the temperature. All these things are done by the hypothalamus. So this hypothalamus releases a hormone called TRH, which is a thyrotrophin-releasing hormone. So this sends a signal to the gland in the brain called pituitary. So this gland produces the thyroid stimulating hormone. So that means this gland is telling the thyroid gland to produce thyroid hormone. Hey, the metabolism is slow. You need to produce more. So that once that stimulus comes to the gland, then the thyroid gland starts producing the hormone, which is T4. And then that later converts in your body to an active hormone, which is T3. I'm going to show that in the next slide. So on this slide, I just want you to know the symptoms of, low thyroid. So the low thyroid symptoms are you can see it here: hair loss, constipation, mental fogginess, and weight gain. Again, we'll talk about the weight gain later because there is some little bit I need to explain, because I see a lot of patients who come to me like, oh, I have thyroid problem, I'm gaining weight. There's more to the story than just a thyroid. We'll talk later about it. And symptoms of high thyroid are heat intolerance, anxiety, shaking, and there's more appetite. So these are the symptoms before we dig deeper into the hormones. So I want you all to actually look at this particular slide. This is actually the most important slide in the presentation. So look at this. TSH is a thyroid stimulating hormone from the pituitary. So this T4 is going to T3. So basically, if you don't convert from T4 to T3, so what body does is it converts T4 to reverse T3. I'm just going to give a simple analogy here. So why body converts to reverse T3? This is example, like, for example, my husband yesterday, actually it happened while I was doing my show presentation. So I'm explaining it to you. He brings the grocery, right? So my kids are not going to eat anything just like that. I have to cook, right? So this T4 is basically a simple uncooked produce there, which is useless unless I make it something. So once I make it available, my kids can eat it. So that is T3. That is the biologically available hormone. So the days if my husband brings the grocery when I'm not ready to cook, like I'm so tired, I have so many other things to do. For example, yesterday I was doing the slideshow presentation. I couldn't cook it. So I just put it in the refrigerator, right? So that is reverse T3. When your body is not ready to produce energy in the cell, that's what thyroid hormone does, then it converts T4 to reverse T3. So the next slide explains a little bit more about it. So what is this T3 is going to do in mitochondria? This is basically me drawing the mitochondria. It doesn't look great, but these are the receptors. The blue dots that you're seeing are the receptors on the mitochondria. So those receptors, the T3 goes and it has to be attached to the receptor to be able to tell the cell, hey, use me, you know. Then the problem here is when you have more reverse T3. Why you produce more reverse T3? When you are stressed out, you produce more reverse T3. It's not always a mental stress. It could be a physical stress. It could be like a food sensitivity. It could be an infection. There's a lot of things that can give you the physical stress. When you have more reverse T3, this is what happens. My analogy again, when too much of the uncooked food goes into the fridge, my kids cannot find the cooked food there. They'll complain like, this is too much. I can't even see my cooked food here. There's too much of the uncooked food left in the fridge. So these receptors are occupied by the reverse T3 because they both compete. T3 and reverse T3 compete at the receptor level. So your cell is not able to really see the T3 because a lot of receptors take reverse T3. So you have to always make sure that your body is not producing more reverse T3. You want your T4 to be converted to T3. That is the most important step of the thyroid hormones that you all need to know. So this one is just TSH, right? We all know what TSH is because everybody gets this TSH. Everybody gets this TSH when you go for a physical. So again, there is another analogy of the TSH is like it has a wide range, like 0.4 to 4.5 is the TSH range. So when you go to your doctors, they tell you your TSH is normal. It's actually not normal. This is how I put it. When you go to your shoe store and the guy tells you that your size is from 5 to 8. So is that normal to you? It is not, right? Your size is only 8 or 8.5, whatever. That only one size fits you. So not all the sizes are going to fit your feet, right? So here, the same thing. Your body normal for TSH is very different from the lab normal range. So I put a little bit here optimal ranges. There are actually the functional medicine ranges there. 1.8 to 2.5 is the functional medicine range. So we want that in this range. So nowadays, actually, this is a standard for any pregnant woman to have this optimal range. When I was having miscarriages, all the time, my TSH was 3.5 and above, but it was within normal range. So my physician did not treat me. In those days, I had to kind of make up some of the symptoms and ask for the treatment. But if you are pregnant, having miscarriages, please keep this in mind. Your TSH should always be less than 2.5. Should be in the optimal range, not in the normal range. So this about the free T4. Again, there are like when T4 is produced, two kinds of T4, like bound and free T4. I'm not really getting into all the details because that will be too confusing for you. So I'm just focusing on the free T4. So the free T4 number should be in the normal range. When you see the labs, this is what they say. But this is the optimal range. Just look at the optimal ranges here. Take a screenshot of this. This is important that you need to know what the optimal ranges are. Free T3 is the optimal range for free T3. And for reverse T3 is the optimal range for reverse T3. In my experience, because I didn't dig into too much research on reverse T3, but in my clinic, when I see a patient who is perfectly healthy and no medical problems, and their reverse T3 is always like less than 8. So in a patient who has like a lot of food sensitivities, lot of gut microbial issues, and their reverse T3 is like almost close to 20, especially when you have anxiety and all those symptoms. So you just go look at your labs and see what your reverse T3 is. And again, I'm going to talk more about these antibodies to the thyroid, because that is an important topic to know. This patient had autoimmune conditions, and this patient developed antibodies, which you can see anti-TPO. I'll explain you in a second what that is. So this is again the same slide. The slide I put it here before I go to the antibody slide is because for you to produce T4 hormone, you need all these things. This is not, your body is not going to produce this hormone if you don't have zinc, if you don't have iodine, if you don't have iron, vitamin B6, all these things are necessary. So if somebody tells you, oh, I need more thyroid hormone, more, why? Because your body is not able to produce it. You need to fix those problems first before you increase the dose of your thyroid hormone, okay? Or to be able to produce before you even get the hypothyroidism, which is a low thyroid. If you keep all these other nutrients proper in your body, you shouldn't have any problem producing your own thyroid hormone, or you don't need to go up on the doses of the thyroid. So the next slide here, this is a study that showed molecular mimicry. So let me explain a little bit about what molecular mimicry is. When you eat or when you have any infection in the body, so the body, your immune system senses that, especially when you have a leaky gut, which is my next slide. I'll go back to that slide. This is basically your gut lining. Okay, this side is a normal lining, and this side is a leaky gut lining. So in the leaky gut, where you see this blue lining is a mucosal layer there. So when you're supposed to have the mucosal layer, if for any reason, because if you have a food sensitivities or if you have any problem on the right side, you are seeing this leakage of the gut. You can see all the red cells there. So when you have a leakage, the undigested food gets inside your body. As long as the food is in the lumen in the gut, your immune system is not sensing it. When you have a leaky gut, it goes inside. Then the body senses it, and your immune system is always there to protect you. So food has some protein sequences, right? So immune system basically takes a photograph of all that protein sequences. So your own body also has similar protein sequences. So immune system is not really that sharp sometimes, most of the time it does a good job. Then sometimes when it is, there is some problem with the immune system, subtle problems we all have, then what it does is it goes and attacks your own body that has similar sequences as the food or the bacteria in the gut, whatever it is. That is called the molecular mimicry. That's what this study is showing about. And there were several studies. I didn't put them all in the presentation here. So they showed that even the bacterial antigens have the same molecular mimicry of your body. So in fact, one of my patients had the same problem. Then when I treated that bacteria, the thyroid problem was gone. In my case, actually, I'll explain you my case easily. So I had the molecular mimicry with gluten. So when I stopped eating gluten, most of my thyroid problem was gone, minimized basically. So that's how each person has their own molecular mimicry. So you need to figure out like why your body is attacking your own thyroid gland. That's the indication. So you can see it here. These are the antibodies. When you have the TPO antibody, body is attacking your thyroid peroxidase enzyme, which is you need for the hormone production. That's usually seen in a condition called Hashimoto's. These all the green blocks you are seeing are for the Hashimoto's thyroiditis. There is other condition called Graves' disease. You mostly develop the hyperthyroidism. So in the Graves' disease here, you're seeing low TSH. TSH is low always when your thyroid is high. So on the other side, when your thyroid is low, the TSH goes up. Those two go other way around, okay? The next slide I'm showing you. these are the thyroid supplements. So I'm not universally recommending everybody to go out there and take the iodine, selenium, tyrosine, zinc. All these are necessary. But if you have a low iodine, you can get your urine checked and you'll see the low iodine. Then you can take the iodine supplements, but don't overdo the iodine supplements at all. Some people are really enthusiastic and take high doses of iodine. That's not good for you. You can get into hyperthyroid stage, which is like excess thyroid hormone. You don't want that. So take the iodine. My personal opinion is I take it in a I take it in a food form. I'm going to show you in my next slide how it looks. And the selenium is also that. Also, I prefer to take it in a food form. So kelp and seaweed, they're all very rich in iodine, and this one is a dried kelp. Okay, I get this dried kelp. You're seeing it on the right side. The dried kelp. I use a lot of curries and things like that. Especially when you make a soup, just throw in a little bit of this kelp in those soups and you'll get a lot of iodine like that naturally. And these are the chips, seaweed chips on the left hand side, the green one. So you can actually have that as a snack also. These are all the good sources of iodine, especially knowing that this is cancer protective and it helps with your breast tenderness, and there's so many uses with iodine. Selenium is also essential nutrient for the thyroid function. So you take don't overdo the selenium because it's a narrow range, therapeutic range for selenium. So just 3 Brazil nuts, 3 to 4 Brazil nuts a day, that's all you need. If it is too low in your blood test, then you can do the supplements also. Now I'm going to come to the myths. This question I get asked like so many times. I have thyroid problem. Can I eat cruciferous vegetables like broccoli, kale, cabbage, cauliflower, and all this? So because you see so much on the internet about this, so I really want to clarify this issue. And should I stop the kale? That is the question, right? The answer to this is these cruciferous vegetables are nutrient rich. They are packed with nutrients. So I simply don't want you to stop these vegetables without properly knowing how it matters to the thyroid gland. Actually, it is true that they compete with iodine, especially at the level of thyroid peroxidase enzyme. So, which is true, it competes with iodine, but there is a solution for this. So, this is more of a problem when you are iodine deficient. So, when your body doesn't have enough iodine, then the competition gets worse, and you are going to be more iodine deficient. So, the important thing here is you need to keep your body rich of iodine, and then even don't stop eating the foods. You can eat the foods, but rotate them. Like when you're eating the greens, kale is like a cruciferous, right? So take kale one day and then go for the other greens the other days, like Swiss chard, there's so many other greens out there. And if you're eating broccoli, Brussels sprouts, or cabbage, don't eat them raw all the time. Like especially kale, you want to, some days you cook them, because I'm a big proponent of raw food diet. So I don't want to tell you again that cook everything. So that's not true, because some days you can cook, some days don't, and rotate the greens, rotate the vegetables, and most importantly, make sure your body is iodine rich. You're not iodine deficient. This is a problem when you're iodine deficient. When you have enough iodine in your body, it's not a problem. So don't stop these vegetables just by reading something on the internet. So again, the same thing applies to the soy. The people ask me, can I eat soy? Is this going to be a problem? Okay, these are all called goitrogens, basically the soy or cruciferous vegetables. So what does it mean by goitrogen? So these compounds compete with the thyroid hormones, and because your thyroid hormone is produced less, then you'll get to that stimulating hormone from the pituitary, thyroid stimulating hormone. When you have more of the thyroid stimulating hormone, your thyroid swells up. That's when you produce the goiter. So they're called goitrogens. Again, the same thing with the soy, same recommendations. You can actually eat the soy in a fermented form. That is one good thing about the soy. You can get so many fermented soy products out there, like natto and a lot of other things like tempeh and all that. Fermented soy, it doesn't have that much effect on the thyroid gland. And don't overeat it. Just eat normally, and again rotate these soy products when you eat it. Then the next slide is about weight gain and thyroid. This is a very interesting topic because I get a lot of patients asking, I'm gaining a lot of weight. No, maybe I have a thyroid problem, which is maybe partially true. Then we look at the thyroid function, and most of the time, let me tell you, it is not the thyroid problem. There is some weight gain from the thyroid, but not everything is goes to the thyroid. Because when you're eating too many calories and you don't control the portion sizes, and too many empty calories, especially a lot of sugar and lack of exercise, all these things contribute to your weight gain more than the thyroid. First, you need to fix those things. Actually, when you fix those things, that in fact helps your body to produce more thyroid hormone. And at the receptor level, I showed you that mitochondrial picture before. At that level, your body can sense the T3 hormone at the receptor when you keep other nutrients healthy and when you exercise. So you need to focus on all those things instead of just blaming the thyroid and asking your doctor for the thyroid supplements. So finally, in the last slide, I want to tell you something. So if you just want to do a test at home on your own to see, just this is not very accurate, but at least you'll get an idea of what your thyroid function is. Take a non-digital thermometer and check your temperature in the morning upon awakening before you get out of the bed, and place this thermometer in your armpit and hold your arm tight close to your body for about 10 minutes, and then check the temperature. So usually your temperature should be 97.8 to 98.2. If this is lower than that, maybe this is a hint that your body is not producing enough thyroid hormone. I mean, it's not 100% foolproof, but if you get that hint, just at least go to your doctor and ask your doctor to do the thyroid hormone testing. So if you have any problem with the thyroid hormone testing, just look into the other factors that I showed you rather than just asking for the thyroid supplements. That is the whole point of giving this talk, because I want you to know that there is a lot you can do than just taking a thyroid supplement. This is all my information. Thank you so much. And that's it for today. I'm going to look at the chart and see whether there are any questions. If you want to ask me anything, you can put it on the chart. I'll stay around for a few minutes. So please post any questions about your thyroid on the chart, or if you are just you're seeing this as a replay, I get these questions on my email, so I will make it a point to answer all the questions.